Sorry about the last video. I think we suddenly, there's a problem there. Suddenly stopped without me realizing. Okay. What I was saying was that the drugs aripiprazole and ziprasidone, they are good in the sense that they have no or very little tendency to cause increase in the glucose levels, hyperprolactinemia, and also weight gain. Okay, let's talk about neuroleptic malignant syndrome. So patients who are sensitive to get extrapyramidal side effects of antipsychotics, they might develop neuroleptic malignant syndrome (NMS). The symptoms include having muscle rigidity, They have sweat issues, impairment of sweating. They might develop hyperpyrexia, increased temperature, and they develop autonomic instability. Okay, so their blood pressure and their stability. Okay, so their blood pressure and heart rate is fluctuating up and down, so it's not stable. So this condition can be life-threatening. Okay, treatment includes giving dantrolene, okay, as a muscle relaxant, giving benzodiazepines such as diazepam, and also dopamine agonist. Okay, dopamine agonist. Next is sedation. This is more especially with phenothiazines, especially with chlorpromazine. Okay, chlorpromazine, it's notorious to cause sleepiness. Among the older drugs, fluphenazine and haloperidol are the least sedating. And among the newer drugs, aripiprazole is the least sedating. The other toxicities, you can have visual impairment caused by retinal deposits, which has occurred with thyroidazine at high doses. And thyroidazine also may cause severe conduction defects in the heart that can lead to fatal ventricular arrhythmias. But luckily, it's rare, very, very rare for people nowadays to be on the drug thyroidazine, so maybe not an issue anymore. Most of the atypical drugs, okay, especially quetiapine, ziprasidone, okay, they can also prolong the QT interval, okay, can prolong the QT interval on the ECG. Clozapine can cause agranulocytosis, okay, so your white cell count becomes very, very low, okay, which is it's quite rare, but then it's a concern. Okay, it's a concern. We have to monitor your blood counts, and at high doses can cause seizures. Okay, fits. Overdosage. Basically, poisoning with the antipsychotics usually does not cause fatality, except for thiazolone. Even though there has been suggested that patients, the elderly patients with dementia, so patients who are elderly and then they have dementia, they have increased risk of of dying, okay, when they are on antipsychotics. If patients develop hypotension because of the drug, so we just treat symptomatically with fluid replacement. When they develop fitting, because because most of the antipsychotics can lower the threshold for getting fits. Okay, they lower the convulsion threshold. They call it convulsive threshold. Means they are easier to get fits. So it's easier for you to get fits if you are on antipsychotics compared to if you are not on antipsychotics. And this can be managed with normal drugs, diazepam, phenytoin. And toxicity with thyroidazine and sometimes the prasidone, okay, can be, when they develop cardiotoxicity, it's more difficult to treat, okay. So I think that's all for the antipsychotics. So this is a basic introduction to antipsychotics. Okay, we'll talk about the individual drugs next time. Okay, that's all.